home. Good evening, everyone. Good evening. Can you hear me okay?
Yes, ma'am.
Wonderful. My name is Demisha, and I work at the Prince George's County Government in the Aging and Disability Services Division. I consider myself privileged to serve the population that we do because those are the ones who are most in need. But before I tell you about me, I'd like to know just a little bit about you and how long you've lived in this community. So if you live in this community 5 or more years, can you raise your hand? All right, keep them up if it's 10 or more years. 15, wow, 20, 30? Wow, okay. More than 30 years. Wow, that's amazing. Fantastic. So it's wonderful to see people who have truly been a part of this committee and this community and committed to making improvements. It's just wonderful to hear all the different things that you all are sharing and relating. And so I look forward to sharing some information with you tonight. In as much as I work with the aging and disability population, I want to emphasize that one of the most important things to understand is the needs of older adults and disabled persons in our family impact the entire family. And so that's why we have these conversations to let you know that what happens to grandmama and granddaddy, it filters down from generation to generation. And one of the things that many of us don't talk about is how that impacts the transfer of generational wealth. So we'll talk a little bit about that this evening towards the end of our presentation. But I want to know, is there anyone who believes that they're familiar with the agency, the Department of Family Services, any of their programs or events or activities? Please share.
I'm actually already on your newsletter because I'm doing a caretaker support group with my church, and majority of our church are seniors.
Excellent.
So because of that, I already get your newsletter.
Excellent. What is it about the newsletter that you appreciate?
Just in general, as far as what I could pass along to the members of my group as far as helping members of our church. Like I said, most people in my church are retired. Very few people are my age or younger.
Yes, very good. Okay, do you mind helping me get my presentation up? I'm going to try to keep this conversation a little bit light. I don't want to talk you all to death because many of you actually have the experience to talk about helping our loved ones as they age, and also figuring out where the pieces come together in terms of community. What I will share at the beginning of this slide is that the work that we do is largely funded through the Federal Older Americans Act, meaning that that legislation puts into place the structure, and those funds are transferred primarily from the federal government to the state government, and then from the state of Maryland here to Prince George's County. So we are not the people who make the decisions, we are simply the ones that implement them. So if you feel as there's an increased need in any particular area, program, or service, then it's definitely an opportunity for you to speak to your legislatures about the things that you want to see change, because that is how the work that we do is primarily funded through grants. All right, we can get started here. I wanted to, you can continue again. Thank you. So just a little bit about, I also feel like I'm standing in front of the screen. Yes.
Well, can y'all, if she steps away, you want to step away so they can hear you?
I want to make sure that you can hear me if I step away. Is that okay? Okay, all right. Let me know if you think I need the microphone, because I'll do that if we need to, okay? All right, very good. Alrighty, so basically I was just relating that this is primarily funded through the Older Americans Act. But one of the things I want to say, and what we can also do, is pass out some of the materials here. I'm going to put some on both sides of the room, and if you could just kind of take one and pass it down. This is the 2025 Senior Resource Guide. You may have seen this before. I'm going to put a few more here. If you'd like to take one for yourself or one for your neighbor, you're more than welcome to. This guide is produced annually and basically provides an overview of programs and services for Prince George's County seniors. Primarily, we're talking about older adults over the age of 60. Next slide, please. But this is not something that we do alone. We work with the community partners. Health and Human Services is comprised of the Department of Social Services, which is a separate entity from Family Services that provides emergency assistance, as well as the Health Department that does a lot of different things in the county, but they primarily help us through assessments, meaning they come into the community and assess what people's needs are. In addition, we work very closely with the Department of Transportation and Public Works in order to arrange some of the transportation services. And those transportation services are found in the center of this guide, as well as our housing resource guide that spells out what types of transportation options that are available for Prince George's County seniors. If you walk away this evening with one piece of information, it would be, if you have a question and if you're not sure, to please call our office. We have a team of options counselors that work and try to provide you sort of a roadmap of programs and services based on your individual needs, because everyone has a different need here. And one of the most important things that I really want to talk about is making sure that we stay active and engaged. So can you tell me, what are some of the side effects of social isolation?
Depression.
Very good. Absolutely. It has been proven that individuals who live alone or who are socially isolated have worse health outcomes, including behavioral health and mental health outcomes, including anxiety and depression. That is an undisputed fact. So the more engaged you are, the more active you are, that's going to benefit you. On the back side of the Senior Resource Guide is a location of all the senior activity centers here in Prince George's County. We work together with the Parks and Recreation Department. Your closest senior activity center is, can someone tell me, the closest one?
For Washington Forest.
That program here is actually one of the closest ones, but your actual formal senior activity center, the closest one is right here on Allentown Road in Camp Springs, okay? That is a dedicated center exclusively for older adults in Prince George's County. So that is a location that is not a shared resource, although you have an amazing community group down here as well. So
Harmony Hall is very active.
yes, they have the Harmony Haulers. They've been rolling and doing their thing for a long time. So we appreciate those who get involved in those community groups. Staying active, doing the different activities are going to help you to stay young longer, okay? And so this is not a solo effort. Our offices used to be on Allentown Road, but they just relocated to the brand new building on Capitol Heights. Anyone know where it is? Right there, at Central Avenue, where the Home Depot is. That brand new 5-story building is a Health and Human Services building for Prince George's County. And that is where you will find our offices on the 2nd floor. But on the 1st floor, I'm proud to announce there is a brand spanking new senior center that's going to be brought here to Prince George's County. It is absolutely beautiful. It has a billiards room, it looked like something out of a magazine. It is absolutely stunning. So we're glad they're going to be opening a new senior center, I believe sometime this winter. So please keep your ears out for those activities. But no matter what your interests are, please make use of Park and Planning's resources. Prince George's County is actually blessed to have one of the best parks and recreation departments in the nation. Next slide, please. Alrighty, so talking about staying active and engaged, one of the things that we do is we participate in volunteer service programs. There's a few of them that are featured on the back of this brochure, which will be our primary point of conversation this evening. One of them, did everyone get one? Let's make sure everyone got one. Okay, go take one for you, one for your neighbor. Alrighty. Volunteer services. We have our foster grandparent program. This is a beautiful program where we have seniors that go into special needs classroom and offer a little bit of extra help to students that might need some support, especially in the areas of reading. And those who may have a developmental disability or delay in their learning. And so that's a beautiful relationship that happens between those foster grannies as well as their students. In addition to that, our RSVP also pairs seniors with nonprofit organizations all around the county doing all different kinds of things. So in your work history, whatever your background may be, whether it be in accounting or administration, whether you provided, firsthand service, it's an opportunity to take whatever those skills may be and bring them back into our community and add that value. And the benefit for you as a senior is that you actually are engaged, you continue to use your brain, you continue to have that capacity, and all of those things incorporated with social interactions will actually allow for you to live longer and reduce the impacts of potential depression, anxiety that comes from isolation. So if you're interested in any of the volunteer services programs, I do have just a little bit of information about our foster grantees program, so please come up and see me. I brought all this information with me. I do not want to take it all back, so please do. So one of the newest programs that we have for sort of the younger end of the spectrum is our Disabilities Apprenticeship Training Program. This is for individuals with a developmental disability of age 25, that they're given an apprenticeship or an actual internship, paid internship in the Prince George's County government that allows them to develop the skills they need in order to be gainfully employed. And they work along with a job coach that really helps them with their interpersonal skills for them to be able to interact with others, be able to develop both soft skills and all those things that allow a person to really flourish in the employment environment. Yes?
Our folks in Zoom land are having a hard time.
They're having a hard time hearing me.
Yes.
Okay, this is what I'm going to do. I'm gonna try the microphone. Let's see what we can do.
Yeah.
Let's see. Testing 1 2, testing 1 2. Okay. Thank you. We're good to go. You can hear me okay? I'm gonna come back over here on this side, just so I don't get any feedback from the microphone. Thank you for people on for Zoom land. If something comes up again, I'll try to make an adjustment to make sure you can hear me as well. Okay? Excellent. Next slide, please. One of the most important things that we have to communicate to people is that we provide services and supports, but none of them, unfortunately, fall into the category of emergency assistance. That means that it is going to take a process in order to apply for, be accepted into, and actually receive services, okay? The part of the county government that does emergency assistance is our sister agency, the Department of Social Services. They're the ones that work with what formerly was known as food stamps or supplemental nutritional assistance. They also administer the formerly known as welfare, which would be our financial assistance programs. They do things like eviction prevention. So the services that we provide are more of a long-term range. And that's important to know because many times people contact our offices when they're having the worst possible time, right? It's when their loved one has had a stroke and we're trying to figure out how to put our lives back together. Or the person who was a primary caregiver is no longer able to do that. So these are the kinds of things that unfortunately happen, but we're not able to respond to on an emergency basis. Although we can connect residents with other services such as the Department of Social Services, emergency assistance for things like utilities. There are a limited number of rent stabilization options. All of these things are things that take time. So I just want to set a realistic expectation as to what we do in our offices so that you know what to expect in that interaction. Next slide, please. Alrighty, we talked about social isolation, and one of the things that we do is our telephone reassurance programs that provides call checks for someone who lives at home, making sure that they're okay, that they have all the medication that they need, and that if they are needing some extra support, that they can connect them with resources in the county or with a family member or friend that is listed as their emergency contact. Next slide, please. In addition to that, Prince George's County has a large Black and brown population, which means that we have a large number of chronic disease, such as diabetes, hypertension, and other chronic conditions. Your programs that encourage folks to be able to make the lifestyle changes that allow for them to live longer. There are no income or asset limitations for those programs, and you're welcome to contact to talk about diabetes, hypertension, as well as chronic pain, self-management as well. Next slide, please. We have a group of advocates that work in various capacities. Our long-term care ombudsman, they actually go out into the nursing homes. We have a nursing home located here in your area, as well as assisted living facilities. There are a number of assisted living facilities here in Fort Washington. They provide support to those individuals to make sure that they know what their rights are and that their rights are being respected, as well as their responsibilities and how to interact and serve as kind of a mediator of sorts between the long-term care facility staff, administration, and the older adult, as well as the family, which can get a little complicated when people have Alzheimer's or dementia. How many of us have a family member or friend who has been affected by Alzheimer's or dementia? Yeah, that's a really, it is a difficult journey, but one that you do not have to take on by yourself. So there are some resources there. Next slide, please. As we get older, our capacity to care for ourselves starts to change. We're going to need increasing levels of help. Many families are able to kind of pull together a plan to be able to get through it. We have people that come in, and the grandparents move in with siblings, everybody figures out how to make it all work. But in some cases, people do not have family members to care for them. Or, unfortunately, they have family members that may be not caring for them, neglecting for them, or they may be physically or financially exploiting them. In those cases, our agency serves as a court-appointed guardian of person for individuals over the age of 60. Our sister agency, Social Services, does younger individuals. In that case, our staff will make day-to-day decisions for individuals who are no longer able to care for themselves. This is not something that we initiate, but rather is administered by the court here in Prince George's County, and we are obligated to follow the court orders to ensure that that individual remains safe and is properly cared for. Next slide, please. A senior nutrition program. So all over the county. Has anyone been to any of our senior nutrition sites? We want to encourage folks there. Our number of senior nutrition sites is another opportunity for people to come into a congregate setting. There's one right here at the Senior Activity Center. Come together, they have lunch. It's going to be a balanced meal, but it's also an opportunity for people who may be living at home alone or eating alone, because eating alone actually results in fewer nutritional benefits than eating with family members. So that is an opportunity as well. There are no income or asset limits to participate in the senior meal program in a congregate setting. And for those who are homebound, there's also the home delivered meals. Who've ever heard of Meals on Wheels? Yeah, just about everyone. Yes, so that is administered through some of our partner groups throughout the county to various locations. If you know someone who isn't quite able to get out to the grocery store or unable to prepare their meals, or has starting to have a little bit of memory slipping, so maybe they're a little hesitant to cook, and because they might leave the stove on or things of that nature. These are all signs that it's time to reach out to our offices so we can start to come up with a plan for folks. Next slide, please. Another thing that happens as we get older, unfortunately, and I know very well, is that we have issues with our mobility. It's actually something that's highly, highly prevalent in the older adult population, and for many reasons, whether it be our inability to maintain our balance or suffering a stroke or some other debilitating condition, individuals may need wheelchairs, walkers, canes, and sometimes even motorized equipment. The state of Maryland facilitates a durable medical equipment program. That means that they receive donations of equipment, they clean it, sanitize it, make sure that it's safe to use, and it's distributed to residents anywhere here in the state of Maryland without cost. The only caveat is that you have to go pick it up. This includes everything from wheelchairs to hospital beds, specialized equipment for individuals who may need that as well. So that program is here as well. Yes.
Is that the facility that's on, in Cheltenham?
You got it, right next to the Veterans Cemetery in Cheltenham. It used to be the location of the food bank many, many years ago, right there off of 301.
And can you do it for somebody else, or the person that's in need has to be the one to go out?
No, not at all. That is something that can be facilitated by a friend or a family member, depending on the type of equipment. If it's like something very simple, it's just as simple like a wheelchair or a walker. That is something that you simply complete an application. It's available on the website here. In addition, I have the information here about this durable medical equipment program. You can complete the application for simple equipment. If it's something more complex, like this person needs a motorized wheelchair or some sort of complex medical equipment, they may need a doctor to sign off on that is the appropriate type of equipment that they need. In that case, that also will be provided to them, and anyone can pick it up on their behalf once they've gone through the application process. Any questions there? No. Okay, very good. Most of the, yes, sir.
Would they come in and, maybe, you need the, where you got stairs, you put in the,
A stair lift?
yeah.
No, a stair lift is not considered durable medical equipment. It's actually considered a home modification. And so there is a home modification program whereby there are grants and loans available to homeowners in order to make the modifications that are necessary in order to live safely at home. But that's really one of the things that's really important. Home modifications are available through a very limited number of programs that they do have home modifications to include things like ramps, stair lifts, and other equipment within the home. But as we age, we need to start thinking about how to create an environment that's going to be universally accessible as we get older, right? Because those stairs they can become quite an obstacle. And I can testify, I had a fall in 2021. I fell down the stairs and I broke my spinal implant. And it was a very long recovery. And so stairs and falls can really have an impact on someone's life, especially if someone breaks a hip. That is probably one of the most impactful injuries, and many older adults, unfortunately, never really rehabilitate to the point that they're able to return to that activity, and it will start a slow deterioration. So making sure that your home is a safe place as you and your loved ones age is going to be really important. And the great thing about universal access is when you make it safe for older adults, you also make it safer for young children. So having the type of changes to your home that allows for you to age in place is part of creating that long-term care plan.
I have a question.
Yes, ma'am.
Does this include outside the home or the modification for when you're aging? Like say if you have like stairs in front of your house or a stoop that is too high that you find yourself being uncomfortable using because of this height. Will this program help you to modify that?
Not this program specifically, but there are what are called home modification programs. Some of them are grants and some of them are loans. And yes, those changes to your home could be inside the house, they could be outside of the house. Anything that will allow for your house to be more accessible and safe for you to live in would be considered a home modification. There is an application process. Those funds become available through grants. There are some limitations on assets, meaning that if you have $100,000 in the bank and you're asking for the state to pay for a ramp to the front of your house, you're not going to qualify. If you own your home, you may be able to take out a loan in order to pay for those modifications.
If you're retired, would that be part of what would help you in getting maybe a grant? If you're on a fixed income.
If you're on a fixed income, every program is going to have the state required, eligibility requirements for, income and assets. And so those vary from year to year, vary from program to program. But you wanna go ahead and apply, and I tell people this all the time, just because you don't qualify this year, they're going to change still of that eligibility criteria moving forward. So it's good to know about what the programs are, figure out what your options are for your individual circumstances. And there's lots of different financial instruments that people use to create that plan, and we can talk about that a little bit later. But it depends on your situation, because something like a reverse mortgage might be right for that gentleman, but it may not be right in your particular, situation.
Is that information up
There is a section in here that does talk about long-term care planning. Kind of the point that our agency stops is talking about caring for you as an individual. When we get into talking about financial management, financial preparation, that's something that's deferred to legal and financial professionals. But it's a great conversation to be had, and we'll talk about that very quickly. I'm actually gonna get to the next section. But as we talk about insurance, it's a really great question. So we're gonna talk a little bit about Medicare, but before we talk about Medicare, I wanna just talk about Medicaid. There's been a lot of conversation about changes to Medicaid. Medicaid is a program that provides insurance. It is not Medicare, it is something different. Medicaid is something that is asset and means tested. You must have a limited amount of income. In order to qualify for Medicaid, does anyone know how far the government looks back on your financial records?
5 years.
5 years. 5 years, okay? That is a very important number to know. The reason why is there are some tools that are available, there's some strategies that some families have used in order to shelter their assets in a way that is not counted towards their Medicaid eligibility. That is not something that we provide as a service, but you should know that that service is out there, okay? For individuals who may qualify for Medicaid, because individuals who qualify for Medicaid are gonna pay no or low costs towards their medical care. It's really important that we talk about that. But before we get there, I'm going to take this and I'm gonna pass this around again. Thank you everyone who's been helping me out, taking one and passing it down. This Medicare guide, I'll take a stack here for this gentleman as well. Thank you so much. And it distinguishes the difference between Medicaid and Medicare. Most people in the room probably have Medicare or someone in their family does. Can I just get a show of hands on that? Yes, okay, someone of you and your family are in Medicare. Every year there's open enrollment. Can anyone tell me what the purpose of open enrollment or the opportunity for open enrollment is?
Change if you want to, get a different
Very good.
company.
And she said to make changes with your insurance company if you want a different type of plan, okay? Every year, every person enrolled in Medicare has the opportunity to make that change during open enrollment. That starts in the latter part of the year. You must do so by the beginning of December. Otherwise, they're gonna keep the same plan that you have and they're gonna carry over into the next year. Our program specifically provides free, unbiased Medicare counseling. What does that mean? We don't support any of these companies, okay? Don't represent them, don't profit from them. We have a team of counselors that will take your individual circumstances, your individual prescription needs, your individual situation, and advise you what plans you have an option. Which ones are gonna result in the least amount of out-of-pocket costs based on your current health situation. That's what we're here to do. So I want to encourage folks to take advantage of this so you can make an informed decision. Because having the plan you had last year might be great. It might work perfectly for you. But in some people, as your health changes, your prescriptions change, what your insurance decides that they're gonna cover this year that they didn't cover last year, it may be a different option that's gonna result in the least amount of out-of-pocket costs. In addition, they can help you apply for programs that provide assistance specifically with prescription drugs, as well as some programs that will help you pay for your Medicare premiums. There is an upcoming event on October the 10th that's going to be facilitated by our state health insurance program. We encourage everyone to attend. There's more flyers than there are people. That was absolutely on purpose. I want to make sure that you share that information with your neighbors, because these are the kinds of events that help you to make an informed decision. Right? So everyone is supposed to sign up for Medicare at age
65.
Okay, can someone tell me what happens if you don't sign up when you turn 65?
Penalized.
I hear you.
Penalized.
Penalized.
But that also depends if you are still fully working a
That's
full-time
true.
job.
That's true, that is true. And so what's right for you in Medicare is not right for your neighbor for Medicare. And so just because this applied to mama, it may not apply to daddy. Everyone's situation is different. So if someone's still employed when they are 65, they only need Medicare Part A. Very good, Part A. They do not necessarily need Part B at that time. But a counselor can explain to you your options and why those are options and what you should do should your situation should change. So someone told me what happens when you do not sign up on time for Medicare? Penalized. Somebody tell me how long you are penalized. For the rest of your life. Okay? I want to be very clear on that. For individuals who do not sign up on time based on their personal circumstances for Medicare, can pay a penalty that may last the rest of your life.
That's even if you're working at 65.
Depending on what type, your individual circumstances. So some people who are still working at 65, the only thing they'll do is sign up for Medicare Part A, right?
But that also depends on, because I had to do a lot of research on this, that also depends on your company and how many employees is in your company. If you have more than 20 and more people in your department, then they will not penalize you and you don't have to sign up. Now, when you're ready to retire, you got 6 months to let them know that you are coming out of, and that's the time to do your enrollment for everything else. If not, you will be penalized.
So everyone's situation is different, that's what I want to tell you. There's a lot of federal employees also living in Fort Washington area as well.
Yeah.
Federal employees have a different circumstance. So what applies to you may not apply to your neighbor and vice versa. The most important thing to do is to be able to have unbiased counseling. That's why we strongly encourage people to contact our offices. And if you're having difficulty paying for your prescriptions, because these prescriptions can be, they can be quite expensive. If you're having difficulty paying your premiums or your prescriptions, we encourage you to contact our offices so they can take a look at your individual circumstances to find out what's right for you and your individual family.
Even
Okay?
if you're still working.
Even if you're still working. I say this seminar is for every single person that is about to turn 65. You're 63, you're 64, now's the time to start collecting information so that you can make an informed decision. Because you may or may not need to sign up for Medicare Part B. We're talking about Medigap, prescription coverage. It can all be very confusing. But rest assured that we have staff that are here to help you with side points. All right, so we're gonna spend kind of the bulk of the remaining of our program talking about long-term care programs. Can someone tell me, when I say long-term care, what are you thinking? What comes to mind?
Nursing home.
I heard nursing home, being a caretaker, what else? Assisted living. Anyone else have any thoughts? Okay. All of those things are part of that. A long-term care plan is basically a plan that's based on your individual needs that allows for you to achieve whatever you desire as an age. For many people, they want to stay in their homes and live at home as long as possible, right? Many people want to avoid assisted living. They want to avoid nursing homes. They would rather be at the home with their family members, being able to receive the care that they need, right? It's really important. One of the things we have to consider is, how do we pay for that? Can you call our offices and just say, hey, my she's getting old, she needs somebody to come in and help her?
Nope.
No?
That ain't gonna happen.
What about Medicare? Will Medicare come in? Absolutely not. Medicare does not provide for in-home care. That is very important to know, because even people in their 20s and 30s and 40s who can make a decision about whether they want long-term care insurance or not, and that's a decision that you have to evaluate for yourself. The time to purchase those policies is when you are a young person. If you try to purchase a long-term care policy in your 60s, it is out of the world expensive, okay? Okay? So having these conversations, even to younger people, is really important for us to understand that now is the time to begin to plan, okay? So what are some of the things that change as we get older? Just go ahead, just say some of the things that change as we get older.
The income.
Our income, yes, many people go into a fixed income.
Unfortunately, we lose limbs sometimes.
Absolutely, we lose our mobility, to ambulate, to get around, all those things change. Anything else?
Quality of life.
Quality of life, right? So that's, talking about long-term care plan is everything that is part of your activities of daily living that affects the quality of your life, right? And as we get older, we find out there are more and more little things that change, right? One of the things that I experienced as I was injured in an accident, and I had nerve damage. And one of the things I had no idea how complicated it would be is I had started having trouble swallowing. All of a sudden, I'm just going through life, and all of a sudden, I'm drinking, and something goes down the wrong way, and I'm choking, right? How did that happen, right? We didn't know that aging in the muscles in our body would affect everything from our swallowing to our toileting habits, to our ability to sleep, to our ability to do all the things we have been doing our whole lives, right? And so that's why it's important to talk about the plan. Next slide. All right, here in Prince George's County, we have one of the highest rates of Alzheimer's and other dementias in the state of Maryland. And so there are a couple of different initiatives in place. One of them is Dementia Friendly Prince George's, that enlists volunteers as well as various other organizations to be able to support individuals that have Alzheimer's and other dementias, as well as their family caregivers. There are support groups. There are people in the community that are doing screenings, inviting people to have conversations about dementia. And this is across the board. We're working with our public safety officers to be able to help individuals who might have some sort of cognitive impairment, seeking to inform our bank tellers and people who are conducting financial transactions on people's behalf, because unfortunately older adults are very susceptible for scams and fraud as well. And if you're looking for speakers to come in the future, there are those public safety agencies that come out and talk about what are the current scams, because you know they change up all the time, right? They change up and they target older adults, especially because they may have cognitive impairment. All right, next slide, please.
Can I just add that we have our dementia-friendly organization led by Dr. Flavia Walton, meets here at this station.
They meet here, okay, yes, very good. Yes, Dr. Walton has been since she's part of the South County dementia-friendly team, and each part of the county has a different approach based on your individual community. I don't know what day that they meet, but I'm sure he'll get you that information if you're interested. Another one of the resources that we have, we talked about Alzheimer's and dementia. I saw so many hands go up for individuals who have those concerns, is we have a Powerful Tools for Caregivers.
And that's a very good course.
It is a very good course. Thank you for testifying there. It is a 6-week evidence-based program. It's done online, so you don't actually have to come into our offices. And each session focuses on a different area of caregiving. And that's super important because caregiving can truly be a labor of love, focused on the labor part. But this powerful tools takes a step-by-step approach to help caregivers be able to handle the responsibilities of caregiving, making sure that they have the support that they need themselves, and that they're getting the training and the education that they need to provide hands-on assistance. Can you tell me how you know that it's a great program?
I've taken it through Holy Cross Hospital online, me and one of the other members of my church before we started the caregiving. Me and one of the members of my church, took that course through Holy Cross Hospital, before I started the caregiver support group through my church, which right now is just for our church. We haven't extended to public, but eventually we will. And we took that course and it was very, very helpful, and especially because it was around the same time I started being a caregiver for both of my parents.
Wow.
So,
Thank you for sharing your experience. And thank you for bringing up support groups. You will notice on the last page of your senior resource guide, there's a listing of support groups that are here. There are various support groups, some of them are in person, some of them are online. But we really want to encourage folks to take advantage of them, because caregiving can be emotionally, physically, mentally exhausting, okay? And it can go on for much longer than we thought it may have, and it may come sooner than we thought that it would have. And so those caregiver resources are available to you. We actually have a virtual and in-person support group in our building. It actually happened this afternoon. It happens every third Wednesday of the month. If there's anyone that would like information about the support group, please raise your hand. I'd be glad to share that with you as well. Okay. Next slide, please. All right, now we're getting to kind of the nitty-gritty of why most people call. Most people call our offices when someone in their family is no longer able to care for themselves.
do you have?
I sure do. Share them with all your neighbors, your friends, your congregation members. Please do. Most people call our offices when something happens. Mama falls, daddy has a stroke. All of a sudden, the person who's able to care for themselves has dementia. They don't remember where they are. They don't remember how to drive. Or they want to drive and they don't want to give up the keys. My grandmama drove until she was 93 and she had a lead foot the entire time. She lived in South Carolina and the speed limit, 84, that was probably my grandmama. Yeah, so they call our offices when something has changed, right? And they're looking for help that comes into their home. Community First Choice is one of those programs that will provide in-home assistance, personal care, nurse monitoring, as well as home delivered meals. But individuals can only have limited income, that is $914, which is not a whole lot.
No.
Okay. And there are also asset limits. So,
Wow.
this is not the only program that provides for in-home care. But if you hear someone say that they got Medicaid and Medicaid is paying for this and that and someone to help, that is probably because they qualify for this program. Okay? And so when you call our offices, I don't want you to just assume that based on what you see, your family member or you won't qualify. It's best to know to get in it, because you gotta be in it to win it, okay? I'll be perfectly honest, many of the programs in Prince George's County have a waiting list. So if you see someone trending in the direction they might need help, now is the time to start planning. Next slide, please. Closely related to Community First Choice is what we call CPAS. It provides some of the assistance as well as some help with some activities of daily living. It too has income and asset limits. Next slide, please. Some of us get to the point that we're no longer really able to live alone. And it may require that we live in a long-term care facility, such as an assisted living. There are several smaller assisted living and care in Fort Washington. They're all licensed by the state of Maryland. They must meet minimum requirements. But they provide 24-hour care and assistance with all activities of daily living. It's important to know that there's a subsidy available. It is only a subsidy. It will provide anywhere from $600 to $800 towards the cost of assisted living. Does anyone can give me a ballpark range of what it might cost a person who needs basic care in assisted living a month? What do you think?
$4,000.
Yeah.
How much?
$4,000.
$4,000.
A month.
5,000?
6.
6.
4 to 6.
All the above are correct, okay? On the low end, $4,000 a month, you're getting a bargain, okay? That's a bargain. That is for someone who has level 1 care, meaning that there are multiple levels, and different facilities have the capability to provide different levels of care. Before a loved one goes into an assisted living facility, they're going to be evaluated by a medical professional that's going to give them a level of care, and that will be followed. They'll have a nurse following their care. We're talking level 1 at $4,000 a month on the conservative end. If we're talking about more than that, if we're talking about memory care, people who need to be in a secure unit, we are looking at $6,000 to $7,000 per month. Okay? That is important to know because as we're planning for the future and we're looking at the assets and what's happening to our real estate and our property, all those things are important things to consider because we don't want to outlive our money, right? And so having an idea of what these things cost is important in order to create a plan. Next slide, please. For individuals that may not qualify for those other programs, such as Community First Choice, our senior care program does provide some gap filling services that helps with different aspects of needing medical supplies, respite care, basically giving a caregiver a break, also with home delivered meals, medical alert systems, and it's designed to help the person stay in their home until other resources become available. Yes, sir.
The income limit of $4,000, is that a year?
No. Let me make it more clear. Actually, better gonna pull up my guidelines here. Let's see, make sure that these are up to date. And we just got a new eligibility criteria that has come out from the state of Maryland. And it has not changed. It has not changed. Yes, that is per month.
Oh, per month.
Per month, yes, that is. Just recognizing that there's also the limits as well. The assets are also considered as, that does not include your home or your vehicle. We're talking about other assets, but that does include if you have like a burial plan, if that has value, or a cash value insurance plan as well. All those things are taken into consideration. I'm sorry, next slide, please. This is another similar program in that it allows people to remain in the community, could be in a home, could be in an assisted living facility, to be able to be provided those same types of supports. This is also a program that is means and asset tested, and I will tell you that there is a wait list here in the state of Maryland. If you're living here in Prince George's County, it is months, plural, 2 years long. They have a ranking system that ranks individuals as to what their need is. So if you have gone through this process, because I see some heads nodding, that they call their offices and they know what it's about. If you see any changes in your family member circumstances or your circumstances, let's say that they have a stroke and they're no longer able to do certain things that they were able to do before, you want to give our offices a call back. They'll reassess the person and possibly give them a higher ranking, and that higher ranking would mean that they would receive either services sooner or they may qualify for increased services. So as your circumstances change, please do contact our offices. Next slide. Many of us who are not extremely low income are going to fall into the category of private pay for long-term care, okay? That is most people. If you worked, you had a career, you worked for decades, you paid into the Social Security system, if you had a decent, income, you took care of your family, it is likely that your income will not be low enough to qualify for Medicaid, right? And we talked about that look back, right? That is 5 years, okay? And I want to assure you that the government is very diligent, okay? They know how much money you made, okay? So if you report it or you don't report it, I assure you that they already know.
They don't have to have you report it, they'll go straight to your bank and look it up in the system, I can tell you from experience. They don't need your bank statements anymore.
This process is data mined, I assure you, okay? I assure you that it is data mined, it is verified by the information that they already have, okay? That 5-year look back is so important when we come to this place of private pay, because what some people have elected to do is to consult individuals, such as the ones that are listed here in the center of this guide, not us, not our offices, to consult with the elder care attorney or a financial planner. And what in those consultations, they are gonna ask about your personal situation and your families and what the potential need is for long-term care, with the understanding that the Medicaid look back is 5 years. So if there's a friend or family member that might be in need of that help, now is the time to talk to a financial professional or an elder law attorney. They can advise you on things like trust and ways to shelter your assets and how you can be able to transfer assets to family members that are going to be compliant with certain regulations. This is how some people have figured out how to obtain care and allow people to qualify for public government assistance, okay? We do not provide that service. I encourage everyone, if you buy anything, including legal services or financial services, is to shop around, get a minimum of 3 quotes, make an educated decision, make sure that you know what you're signing up for, make sure that you get referrals from friends and family members and make an educated and informed decision, right? That is the way that some families have decided to prepare for long-term care. There's a whole page here in the middle. We do not endorse any one agency. This is not an exhaustive list of firms that provide these services. We just encourage you to know that they're out there and that it might be something, a conversation that you and your family might want to have now if you have aging family members. Next slide, please. So we talked a little bit about this, and some of the instruments that some families have chosen to use is long-term care insurance. But I told you the time to buy long-term care insurance is when you're young, right? It's pretty much the only time. It is like most insurances, you are going to have to pay a monthly premium. There are some companies that have a limitation to pre-existing conditions. Some families have chosen to also utilize a reverse mortgage. This is a complex solution that may work for you and your family, but it needs to be a really in-depth conversation and making sure that everybody has the same expectations and understanding the impact of having a reverse mortgage, because that property could become the entity for which you receive that reverse mortgage. It would become their property, okay? And so that has implications, because sometimes people have different expectations of what's gonna happen with grandmama's home, right? So we encourage you to make informed decisions. If you contact our offices, we provide you free public education in order to help you to contact someone to make an informed decision. Next slide, please. All right, so many people fall into the category of needing to hire help, okay? That could be any range of individuals from CNAs to nurses to individuals that simply provide companion care. And you want to consider your options. There are also a number of companies listed here. Many of those companies have minimum hours for which they need to provide that care. And that's typically done on an hourly rate. Can anybody tell me what they have experienced on an hourly rate for someone to come into the home and provide care?
35 minimum.
35 minimum is what I heard. Anyone else?
35 minutes?
That's what she said, 35 minimum, $35 per hour. That what you heard you say?
Yeah.
Anyone else have an experience? Okay, depending on the level of care that the person is providing, you are going to come in at a minimum somewhere around, on a conservative end, $20 per hour at a minimum, okay? We're talking about companion care. We're not talking about somebody who's skilled,
Right.
who knows how to assist a person take medication, or who's certified to administer medication. That's a whole nother level, okay? Right? So when we're talking about developing a plan, knowing that that cost may come in at $35 per hour for a minimum of 4 hours every time that person comes out, helps us to make an informed decision and plan for the future. Because it's possible that a person does have a retirement fund and they also are able to have that money in the bank to pay for in-home care. That's not me. I'm a public servant, I don't think I'm gonna make it there, so,
Drain your bank account.
I plan to be destitute, that's my whole strategy. Yes, ma'am.
Do you all have a list of people who have been screened by the county for like personal care, just personal care?
Excellent question. They are all licensed through the state of Maryland, so all providers actually can go from jurisdiction to jurisdiction. They're administered at the state level. They're provided oversight by the state, and it is an Office of Healthcare Quality that licenses all skilled care companies, as well as nursing homes, as well as assisted living facilities. All of them are licensed and monitored at the state level. If you contact our offices, you tell them what type of assistance that you're looking for, and they will give you a list of everyone that falls into that category for skilled nursing care, for assisted living, for all those different types of services that are servicing vulnerable populations.
You call your office for that?
Absolutely, you call our office, it's 301-265-8450. Did I answer your question? That information is also publicly available through the State of Maryland Office of Healthcare Quality. But one of the advantages of contacting our offices is we're going to help you know how to make an informed decision. We're going to give you a checklist to say, these are the things you want to look for when you're looking for skilled nursing. This is what you look for when you're looking for companion care. You want to make sure that there's compatibility between the company's policy and what your family needs. You want to make sure that there's a clear expectation of duties so that you know what you're paying for. And that what you're paying for matches the level of care that you or your loved one needs. Okay. These are all the types of questions that our staff is trained to answer. There is no one-size-fits-all solution, because everyone ages differently and everyone's goals in terms of aging also are different. And so developing a care that accounts for financial, emotional support, being able to care for activities of daily living, taking into account socialization and spirituality, all those things are important components. But all those people that touch all those different things are part of creating a long-term care plan. So we want to assure you that you're not alone. You don't have to figure this out on your own, that we have staff that are here to help. Finally, circling back to the home modification program. Next slide, please. We talked about a couple of those. We talked about the stair lift. This one is the Accessible Homes program. These are the income and asset limits, and they are only available for individuals who age 55 and older who own their home, and they can receive a zero interest loan for a set period of time. Next slide, please. This was I'm talking about housing rehabilitation. Housing rehabilitation. These are things that we're talking about, making changes to your home to make them more safe. It could be something as small as grab bars in the bathroom, railings to make sure that people are getting up and down the steps safely, widening of doorways to make sure that they're wheelchair accessible, as well as ramps into homes. There are nonprofit organizations that do support home modifications, and they vary on funding based on what their grant towards and what's out there at this time. Next slide, please. There's been lots of questions about the tax credit program here in Prince George's County. Does everyone know that there's a tax credit program that was implemented about 3 years ago?
Yeah.
Yes. So there is a tax credit program here in Prince George's County. You want to look at your individual circumstances. Next slide, please. Next slide, please. Back just one more for me. Thank you. You have to be 65 and older, and you must have lived in that property for 10 or more years, which doesn't seem to be a problem for most of you all here. In that there is a limit of the value that your home can be, and I think it's a little bit higher. Every year, the assessed value will go up a little bit higher. It may be a little bit higher than that, but it's important to know that the application is made by October 1st, right? By October 1st for the prior tax year, okay? Next slide. These programs can work in conjunction with the homeowner's property tax credit program. They also have some limitations, and there's also a renter's tax credit program. Most folks here in Fort Washington are homeowners, but there are assistance available for those who rent as well. You can contact our offices for an application, and if you're over the age of 72 here in the state of Maryland, you can go back 3 years to receive renter tax credit as well. Next slide, please. All right, so we're coming out to the end of the presentation. I know I've given you all a lot to think about and a lot to talk about. Are there any questions? Wow. No questions? I covered absolutely everything? Wow, okay, well there.
Questions in Zoom
Well,
land?
yes, ma'am. How does the tax credit program work? I will tell you that I'm not the best person to answer that question. I would suggest that you contact the Department of Finance for the county government. And if you don't have that information, the best thing to call if you're looking for county government resources is to call 3 numbers. Does somebody know what they are? 311. Call 311. You can call 311, say, I'd like some information about the tax credit program. They will connect you with the Office of Finance. They'll explain to you all the programs that you qualify through the county. If you're looking for state-administered programs, such as a homestead tax credit, they'll explain to you how those work in conjunction with one another as well. But you can call 311 about a lot of different things, right? Yes, so that, yes, ma'am.
One of those tax programs that you put up is no longer available.
Which one is that?
That's the one with the maximum home value of $5,000.
That is no longer available.
Yeah, that's no longer available.
Okay, well, thank you, I was not aware. I don't fall into that category at all. Really? Okay, well, thank you so much.
But they can qualify with this close. They had one where they would provide seniors with assistance if they got behind on their tax bill or something of that nature. So they came up under, if you're in District 8. Oh, exactly, yeah, so that's different. You know, if you have issues paying taxes, you go to District 8 for this assistance.
Okay, for those who are on Zoom, I was informed that one of these tax credit programs are no longer available.
That's the one for the maximum value of the home of $5,000.
Okay. Senior tax credit is no longer available, but for individuals who likely don't live here but live in District 8, there may be a limited. Oh, this is District 8. There may be available some assistance for individuals that need assistance with their tax. I thought this was 7. It's 7, right?
So this is District 7 Police Station.
Okay.
This is Councilmatic District 8, but our neighbors are Councilmatic District 9.
Okay.
So, right, so, yeah, it's 7, it's all,
Yeah.
it's
So,
confusion.
So I would say the best thing to do is to contact your councilmatic district office and ask what supportive services, what resources might be available. If you don't know what your councilmatic district is, you can call 311, provide them your address, and they will tell you which district that you live in. Okay? Alrighty, well, I think that is more than my time.
Can we give Ms. Demisha a round of applause?